Good morning, everyone, and thank you for coming here this morning. To my right, I'm joined with Dr. Rachel Foreman, who's the current spokesperson and board of director with the Ontario Medical Association. Dr. Foreman is an obstetrician gynecologist as well as a reproductive endocrinologist and fertility specialist in Toronto. We're here today to discuss access to medical assistance in dying and conscious rights protection for healthcare professionals. Our party is extremely disappointed that the Liberal government voted against all our amendments that would have protected healthcare professionals from discipline from their colleges for refusing to participate in medical assistance in dying in Bill 84. A balance is needed to ensure patients have access to medical assistance in dying in the province. The self-referral model announced by the government, which we hope is patterned after Alberta, will improve access to MAID. The PC party is supportive of that referral model. However, Alberta and other jurisdictions do not discipline their healthcare providers for refusing to participate in MAID on moral or religious grounds, and that has not hindered access. In committee, Andrew Ignatieff, a board member of Patients Canada and a lifetime family caregiver working in an in-home hospice care, providing palliative care to people in their home, said at committee that access must not depend on a physician who is unwilling to have a role in physician-assisted death for whatever reason. Forcing a doctor to do what goes against their belief system, including referring, will not work for the patient. Therefore, in this case, Patients Canada asks for a process that is independent, whereby patients can be immediately directed to a practitioner within easy reach and willing to ensure a dignified end of life at an opportunity of the patient's choosing. Balance is needed. My bill will provide that balance by making participation voluntary, ensuring healthcare professionals cannot be disciplined, fined, or censored by their college for refusing to participate either directly or indirectly in medical assistance in dying. Protection of conscious rights and the self-referral system run by the government fit hand in glove, provides a balance and ensures patient access to medical assistance in dying. I wish this Liberal government would have listened to the opposition, listened to the stakeholders coming forward, and perhaps working together we could have found a solution in Bill 84. But unfortunately, that was not the case. My hope is the Liberal government will allow a free vote in the legislature when this bill is debated on May 18th. I now invite Dr. Foreman for a few remarks.
First, I would like to thank MPP Jeff Yurek for inviting me here today to speak on behalf of Ontario's 29,000 doctors. I would like to start by acknowledging that medical assistance in dying is a challenging issue for the medical community as it is for society. The Supreme Court of Canada recognized this when it said in its ruling that the rights of physicians to exercise conscientious objection will have to be reconciled with citizens' rights to receive aid in dying. This has not yet happened in Ontario. The Government of Ontario introduced Bill 84 in order to fill regulatory gaps left by federal legislation. Several physician groups and other healthcare stakeholders joined the Ontario Medical Association in asking for an amendment to protect physicians who are conscientious objectors from being obligated to participate in the medical assistance in dying process. Despite this, the government did not approve supporting amendments clearly stating that physicians have a right of conscientious objection and that the right supersedes any College of Physicians and Surgeons of Ontario policy. On behalf of Ontario's doctors, I support the private member's bill brought forward by Jeff Yurek, which will afford physicians this protection. This is too important an issue to be left as a gray area. This legislation will clearly protect the conscientious objection right of physicians, while Bill 84 addresses the needs of patients to access this service. I urge all MPPs to support this legislation. Thank you.
Thank you, Doctor. In closing, Patients Canada has said it does not benefit the patient to deal with a doctor who's not okay with referring. OMA has stated there's quite a few medical challenges with regards to not protecting the conscious protections. Both groups are in agreement on a standalone referral process for different reasons, but both are very valid. I thank you very much.